Welcome to Neonatal Impedia, your trusted source for neonatal parent and provider information. Hey guys, welcome to Neonatal Impedia. My name's Meredith and I'm a board-certified neonatal nurse practitioner. Today we're going to continue our series on who is taking care of my baby. We have a special guest named Shirley. She's a neonatal respiratory therapist, and she's going to explain exactly what neonatal respiratory therapy is and how they take care of your baby in the unit. If you have any questions or comments, please like and comment below, and I hope you have a great day.
Hi, my name is Shirley, and I am a neonatal respiratory therapist, and I work in a level 3 NICU. Neonatal respiratory therapist is a specialized healthcare professional who is focused on the respiratory care of the newborn. You can go to school and acquire your respiratory certification, respiratory degree, through either a 2-year associate's degree program or a 4-year bachelor's degree program, and there are even some master's degree programs now as well. When you complete your degree, you are able to sit for what we call the CRT, and that is the Certified Respiratory Therapist Certification. Once you are certified, you can apply for a state license and work as a respiratory therapist. So after you get your CRT, you can then sit for your registry, and that is your RRT, or what we call the Registered Respiratory Therapist Certification. And each state requires you to apply for a license to work in that particular state as a respiratory therapist. Most states require you to renew your license once every 2 years, and you need to show proof of continuing education and not have any complaints against your license, and show proof that you have been working in your field. It is against the law to work under an expired respiratory care license or without a respiratory care license. It is against the law, and you can go to jail and or be fined. After you get your CRT, you can sit for your RRT, which is your Registered Respiratory Therapist Certification. And each state requires you to apply for a license in that state to work and practice as a respiratory therapist. It is against the law to practice in any state with an expired license or without a license at all. And most states require you to renew and update your license every 2 years, and to also show proof of continuing education and working in your field, and also not having any adverse complaints against your license as well. So after you're registered, there are also several specialty credentials that you can study and sit for as a respiratory therapist. The most common one for those of us who work in the NICU is what we call the NPS, and that's the Neonatal Pediatric Specialist Certification. As a neonatal respiratory therapist, we care for newborns with a wide variety of respiratory conditions, including RDS, is something we call respiratory distress syndrome, TTN, something that's called transient tachypnea of the newborn, meconium aspiration syndrome, and meconium, of course, is something that when the baby goes number 2 inside mommy's belly before it's born, and they breathe that into their lungs, and it can cause them to develop a really severe condition called PPHN, which is pulmonary hypertension in the newborn, and many other respiratory conditions as well. So we are specially trained to operate a number of different machines and devices and equipment that is specially designed to manage the different respiratory conditions that can occur in a newborn, whether it's just simple oxygen or something more serious like a ventilator breathing machine. As a neonatal respiratory therapist, we work very closely with the neonatologists, the neonatal nurse practitioners, all of the NICU nurses, and the parents to come up with a successful care plan for each of our newborns. Through around-the-clock assessments and lab work, we document and provide updates to the providers on the progress of each one of our newborns. We're also a part of the direct emergency response team to manage and secure the airway and manage oxygen status in the event of a cardiac arrest or a respiratory arrest. One of the most crucial and critical parts of the job as a respiratory therapist is being a part of the emergency response team that is there to secure an airway and manage the oxygen status and ventilation status in the event of a cardiac arrest or a respiratory arrest. As a neonatal respiratory therapist and being a part of the NICU team, we also go on a lot of deliveries. We go on all of the preterm deliveries, any of the high-risk vaginal deliveries, and also all of the C-sections. We are there to help in the event of any respiratory and resuscitation efforts that may be needed in those first moments of life. As a neonatal respiratory therapist and being a part of the NICU team, another one of our responsibilities is to attend deliveries. We attend deliveries of all the preterm babies, which is anything under 35 weeks. We also attend all of the C-sections, and we attend the high-risk deliveries as well. We are there to assist with any respiratory or resuscitation efforts that may be needed in those first moments of life. There are several symptoms that we look for in babies that can tell us whether or not they are having trouble or if they're in any type of respiratory distress. A couple of them is if the baby's blue and not turning pink, if they are doing what we call nasal flaring, they're pretty much just opening their nares or their nose just like this, and they're trying to get in more air, and that lets us know that they are having trouble breathing. If they're breathing really fast, then that lets us know that they're having trouble breathing and they could possibly need some help, and we need to assess them a little bit further. The role of the respiratory therapist in the NICU is to focus solely on the intervention and support of the newborn. And that is very crucial in the early stages of life to prevent any long-term damage to the brain and all of the other vital organs from a lack of oxygen. It's very important to have a great relationship between the respiratory therapist and the rest of the NICU team. You need to have a good rapport and a trusting relationship between your practitioners and your neos and your therapists. The babies just have a better outcome if the team knows how to work together, if the team is trusting of each other, and the team can come up with a care plan that is going to be in the best interest of the baby and be able to support the parents as much as possible. I hope you enjoyed learning a little bit about our specialty here, and we need more. There's always a need for respiratory, whether you can do it with babies or adults. There's always a need.
Here at Neonatal Inpedia, our mission is to provide invaluable guidance and support to both parents with NICU babies and the incredible NICU staff who support them. We understand the challenges and emotions you face every day, and we're dedicated to be your go-to resource. However, it's crucial to emphasize that the information we provide is not medical advice. While we strive to offer accurate and evidence-based insights, every baby and every situation is unique. Therefore, we strongly encourage you to consult with your healthcare provider for personalized guidance and recommendations tailored to your specific circumstance. As we wrap up this video, we want to remind you that you are not alone in this journey. We are here to empower you with knowledge, offer comfort, and foster a sense of community. Together, we can navigate the complexities of neonatal care, and together we can provide the best possible care for these precious little ones. Please remember to like, subscribe, and hit that notification bell so you won't miss any of our future content. Your engagement fuels our commitment to create more videos that matter. Thank you again for joining us on Neonatal Impedia, and we look forward to being a part of your ongoing journey. Until next time, take care, stay strong, and know that you are making a world of difference in the life of your NICU baby.